Much like the closures of bars, dining rooms, entertainment centers, and gyms, the extended school closures will have an immense impact on our families throughout Los Angeles County, especially of thousands of children and youth. It will surely add an extra strain to countless parents, foster parents, and family members who may be juggling their own work issues while trying to ensure the children in their care have access to online resources to continue to learn. We know this will impact the emotional and social well-being of so many developing young minds who will miss their interaction with friends, sports programs, art classes, and other activities that help nurture and develop youth into adulthood. There are thousands of incredible teachers whose jobs have been upended, many of whom are tasked with creatively adapting their teaching methods to remotely meeting students' needs. I commend our hardworking teachers and school faculty every day, especially now, as they are selflessly navigating this crisis to put students first. In addition to the guidance issued by the state this morning regarding our school closures, California has provided suggestions for each local school district to continue to serve as a community resource for parents and for children. The state has asked all school districts to develop a plan to ensure that our students are supervised during school hours. They have also advised that all school districts that are closed will continue to provide essential services for children and for their families. California leaders are asking for schools to consider additional ways that they can support parents and the children. First, to use school sites where feasible as critical pop-up childcare programs for those working families. Second, to partner with their local resource agencies to connect families in need of care. And finally, to provide families with a list of known local programs that remain open for services so that they have options. The state is providing information online so parents can access various programs such as childcare. The County of Los Angeles will post links to all this information on our website dedicated to the coronavirus. The website can be found at lacounty.gov/COVID-19. Again, that is lacounty.gov/COVID-19. Dr. Deborah Dorado will share in more detail about the impacts of the school closures and what Los Angeles County is doing to prepare youth, caregivers, and educators. Thank you all for your continued support as we navigate this crisis, which is affecting each and every one of us. I will continue to implore throughout Los Angeles County to use common sense and our good intentions to protect the safety and well-being of our youth, adults, and seniors. And with that, I would like to invite Supervisor Hilda Solis, Chair Pro Tem of the Los Angeles County Board of Supervisors, to say a few words. Thank you.
Thank you, Chairwoman Barger, and good afternoon and hello to everyone. I'm Supervisor Hilda Solis. I'd like to thank our county departments and agencies for their ongoing efforts to protect the health of one of our most vulnerable populations in Los Angeles County, people experiencing homelessness. Our Office of Emergency Management, Department of Health Services, Department of Mental Health, the Los Angeles Homeless Service Authority, LAHSA, and City of Los Angeles have been working together along with our many homeless service providers to move as many people as possible indoors. Given the COVID-19 crisis, we are acutely aware that there are 44,000 unsheltered individuals in Los Angeles County and more than 5,000 individuals experiencing homelessness that are over the age of 62. Moreover, much of our homeless population may have underlying chronic health conditions which puts them at risk of increased infection. That is why it's more urgent than ever to expand our capacity to offer shelter for these individuals immediately. We currently have more than 7,000 interim housing beds in our existing homeless service delivery system, and we are working to put thousands more online over the next few weeks and months. As a part of our effort to expand shelter, we're extending our winter shelter program. Countywide, there are more than 1,000 beds available in winter shelters, shelters that have been operating since November of 2019. While the winter shelter program typically ends on March 31st, the county has been working with LASA and the City of Los Angeles to extend all 15 winter shelters through at least April 30th, 2020. We continue to assess properties throughout the county that could serve as interim shelter. Even before COVID-19, the county has been utilizing its own assets that could serve as emergency, interim, and supportive housing for people experiencing homelessness. There are many potential sites that have been identified throughout the county, and our departments are working as we speak to operationalize them with the needed services and staff. Additionally, to help protect the health of individuals who are unable to access shelter, we're expanding access to bathrooms and hand washing stations. County and city-owned facilities such as parks will allow access to bathrooms. LASA has identified more than 250 sites countywide for mobile hand washing stations. These will be placed in areas where we know there is limited access. We're also working to get medical supplies, masks, hand sanitizers to our service providers. These materials are in high demand, and we do ask that people donate them if possible. Our Department of Public Health has worked with LASA to provide specific guidance for our homeless service providers who are also operating shelters throughout the county. Additionally, our Department of Public Health is providing regular briefings for our service providers on how best to protect staff and people experiencing homelessness during this outbreak. LASA has also set up a hotline for service providers who have specific concerns or questions. That telephone number is 213-223-4796. The county will continue working with our cities and service providers and will continue to foster innovation and creative solutions to this emergency. I want to talk about food security. First, I want to reassure everyone that there is no shortage of food, but we know that there's a need to ensure access to food. School districts across the county are working to provide meals to our students. Some of them are offering a grab-and-go service at designated locations to pick up meals. LA Unified School District is offering this service, and more information can be found at achieve.lausd.net/resources. You can also access information from our school districts in the First District at my own website, hildasolis.org. Dr. Deborah Duarte of Los Angeles County Office of Education will share more information about this shortly. During this time, I want to remind everyone that it's also easy to apply for CalFresh benefits. CalFresh helps individuals and families to afford nutritious food, including fruit, vegetables, and other healthy options. CalFresh food benefits are provided on electronic benefits transfer, EBT debit card, and can be used at any grocery store or farmer's market that accept EBT cards. We would like to encourage Los Angeles County residents impacted by the COVID-19 to apply for CalFresh today. Applying for the program is easy and simple, online or by phone. DPSS encourages everyone that is faced with food insecurity to contact their customer service center at 866-613-3777 or submit an application online at www.dps.lacounty.gov or www.getcalfresh.org. Thank you very much.
Good afternoon, everyone. I'm Barbara Ferrer, the director of LA County's Department of Public Health, and I want to again thank the media for the great coverage and continuing to put out very accurate information, absolutely essential that all of your viewers and listeners and readers have good information at this time that's particularly trying for so many who live in our communities. I want to also acknowledge the tremendous leadership we're blessed to have here in the county, Supervisor Barger, Supervisor Solis, and all the other board supervisors who have worked tirelessly to make sure that not only is there good information available, but most importantly, that we're aligning all of the county's resources to support everyone who is, and particularly those who are disproportionately impacted by all of the changes that we've asked people to make. And lastly, I want to thank all of my fellow department heads here at the county. You're hearing from some of them today. But I know that every single county department is a part of this an effort to make sure that we are doing everything we can to provide everyone who lives here in LA County and works here in LA County with as safe an environment as possible. I also want to acknowledge that so many of you have made the changes we have asked. You have really done an amazing job at practicing social distancing. And for those of you for whom this has been a huge hardship, I want to applaud you for taking this seriously. Anybody out there who doesn't quite understand why we're doing this, I hope you'll listen to all of us today and can come away from this with a deeper appreciation for why it's important that everybody needs to contribute and everybody needs to take the action steps we're suggesting. I wanted to start by updating you on the current case count here in LA County. Today we're reporting 46 new cases. That brings the total number of cases in LA County to 190 cases. That means we had 96 new cases over the last 48 hours. These cases include 8 cases reported by our partners in in the city of Long Beach, and 2 cases reported by the city of Pasadena. Both of these cities have independent public health departments. All confirmed cases are being isolated and close contacts are quarantined. You can see the updated report of our LA County cases on our Department of Public Health website, publichealth.lacounty.gov, and on that website you will get a listing by city. I do want to remind everybody that if you don't see your city on there, I hope that you don't take that as a sign that there's no need for you to worry. We have cases everywhere in LA County. What we're showing you are those people who have been tested, but you can assume that for every case where we're testing people, there are maybe 5 to 10 cases in all of our communities of people who haven't been tested but are in fact infected with COVID-19 and able to transmit that to others. This is the time for universal precautions. We're going to see an increase in positive cases today, tomorrow, and in the foreseeable future, likely for the next 4 to even 12 weeks. But that doesn't mean that all of our actions to really dampen the number of new cases are not working. Because we cannot stop the spread of COVID-19, all of our strategies are aimed at slowing the spread. And we need to work hard to make sure that that happens. The slower the spread of the virus, the more we're able to maintain the capacity of our essential healthcare system. This is what you often hear as flattening the curve. It's really critical that everyone understand that you have the capacity to both become infected yourself and to infect others. So the only opportunity we have to flatten that curve is if everyone does all of the social distancing that we're recommending and you adhere to any orders of isolation or quarantine that the department is giving. Those health officer orders that we put out a couple of days ago, those are legally binding. I know there's been confusion. I want to remind people that the orders to close bars, wineries, breweries, restaurants are not allowed to do in-house dining. We have gyms closed, movie theaters, entertainment centers. We ask everyone who has an event planned that it must have less than 50 people, and those people must be able to be socially distanced at 6 feet by keeping 6 feet apart. I know that there continues to be questions about whether restaurants do in fact need to adhere to a health officer order. Yes, everyone does, and our health inspectors are out and people are able to let us know if there are any violations, and we will give you good information so that you can quickly come into compliance. I want to take a moment to just explain a little bit more about social distancing. Everyone should remain at home as much as possible. I get lots of questions about, are we locking down? Do we have to all stay in our houses? Everyone who can should stay at home as much as possible. That means that you should, however, feel free to take a walk, a hike, a run, just not with a group of people. It means for many of you that if you need to go to the grocery store, you should go. You should try to go and not stand online. You should try to go when it's not crowded, except for people who are elderly, and I want to talk about that in a second. If you're able to work from home, thank your employer and make that work. We recommend that whenever possible, children be cared for in their homes, and we hope that you can make an arrangement with your employer and get a trusted babysitter when needed. But I do want to give my thanks and appreciation to all of the essential service workers that are out there that are not able to stay home, and that in fact we all rely on to be able to go on and live our lives. That includes the people working at our grocery stores and our pharmacies, our hospitals, our first responders, our public safety folks, our public health folks. This is the group of people that are getting up every single day, going to work, and making it possible for us to, in fact, have the infrastructure we need so that we can weather the COVID-19 epidemic that we're faced with. Some essential workers do need childcare, and childcare is an essential service. That means that the childcare centers that are open are adhering to our recommendations about, again, doing as much social distancing as possible. I want to also say, if your child is sick or you are sick, you need to stay home, and now you need to isolate yourself from others that are in your family unit. But you cannot go to work, and your child should not be going to childcare if they have any symptoms of even mild illness. It's especially important that for those who are elderly or have serious health concerns, they need to be able to stay home. And while we really appreciate that the grocery stores are offering special hours for seniors, the safest option for all seniors is to have food and medicine and essential services delivered to them in their homes. The county's working hard to support this effort, and I urge all of us to check in on our elderly family members and our friends and our neighbors who may be elderly by phone, and offer to bring them their food and their medicine or anything else that they need to be able to stay home. It's also important that we keep our connections during such difficult times. And even though we're all practicing social distancing, nobody has to be alone. If you're feeling particularly stressed or overwhelmed, I urge you to call the LA County Department of Mental Health Access Center at their helpline 24/7, 1-800-854-7771. Please don't be discouraged, and please join together in hope that the measures we take here in LA County are saving lives and making a big difference in slowing the spread of coronavirus. Thank you very much. And I want to now introduce Kevin McGowan, the Director of Emergency Management for the County of LA.
Thank you, Dr. Furr. Today I wanted to take a moment to talk about how we as a community can engage. Public health pandemics like the one we're facing currently disproportionately affect our most at-risk populations. And it's vitally important that our community comes together through donations to help assist in how we can mitigate and reduce the impacts to these at-risk populations. So LA County's philanthropic community has stepped up in a very big way, and there are 2 pooled funds currently in place to help manage our donation efforts. The California Community Foundation has launched a COVID-19 LA County Response Fund that will address the immediate and emerging needs. The fund will be community-based in the areas of health, housing, and education. I encourage everyone to learn more about how they can assist with this donation effort by visiting calfund.org/COVID-19. And in addition to that, the United Way of the Greater Los Angeles has launched a pandemic relief fund to help LA County's unsheltered populations. This is a population that we know will also be at risk and could potentially be disproportionately affected. And I encourage everyone to also visit the United Way's website of Greater Los Angeles to assist in our efforts to provide as much support as a community to our most at-risk populations. Thank you. And with that, I'm going to introduce Dr. Christina Gali from our Department of Health Services.
Hi, good afternoon. I'm Dr. Christina Gali, the Director of the Department of Health Services for Los Angeles County. I just want to start by thanking everyone. I know this whole effort has involved many people across the board, and I just wanted to offer my sincere thanks to elected officials, first responders, public safety, healthcare workers, public health officials, social safety, social services workers, and many, many others. I know this is a team effort, and I just want to acknowledge and extend my thanks for all the work that everyone is doing. On behalf of all of the hospitals in Los Angeles County, we urgently urge residents to take the preventive steps that have been outlined by Dr. Farrar and the Public Health Department, specifically with respect to social distancing, so that you can reduce your exposure to COVID-19. With the increased incidence of community-based transmission, people should assume that those they come into contact with might be positive for the virus. As Dr. Ferrer shared, not everybody is necessarily being tested, and there are individuals who have the virus who we don't necessarily know that they're positive based on a positive test. So we need to be careful and diligent and respect all of the social distancing guidance so that we can help prevent the spread of the infection and seek to flatten the curve, and by doing so, preserve the healthcare system and the lives of those around us. It is imperative that we preserve emergency services for those who truly need them in order to not overwhelm the healthcare system. As I've mentioned before, please do not call 911 or go to the emergency room solely for testing for COVID-19. If you are experiencing mild fever or mild respiratory symptoms, contact your personal provider for guidance. If you don't have a personal provider, you can call the county's toll-free 211 line in order to identify one and locate one within your area. I also want to make a plea for continued blood donations. Blood supplies are critically low across the United States and in Southern California as a result of this outbreak, with the American Red Cross reporting tens of thousands of canceled donations. There is absolutely no clinical evidence that COVID-19 is transmitted through the blood, and we urge eligible and healthy adults to donate and to visit the American Red Cross website in order to find a location for donation close to you. As I reported yesterday, all hospitals in Los Angeles County have activated their emergency plans to prepare for potential surge in patient cases and to expand their ICU capacity in particular. Hospitals are in the process of setting up tents to screen people prior to entry and are establishing alternative locations where patients can be isolated following triage. Hospitals prepare for surges in patients in many ways. They cancel elective surgeries, they discharge inpatients as quickly as possible, they bring on additional staff, and they seek flexibility from the state and other regulatory authorities in order to use spaces that are not typically used for inpatients. All this will help to increase the capacity of beds in the future. The county and state are also working together to bring on additional capacity and alternative locations in the near future. DHS specifically is taking immediate steps to respond to our own patients' needs and alleviate unnecessary emergency room volume. We are ramping up telemedicine services and video conferencing services so that people don't have to come in if they don't need a face-to-face visit. Lab results are being posted immediately on online patient portals. This includes COVID-19 test results. Patients can also message their provider team electronically in order to obtain results. Many of these services are available for patients across multiple different plans and providers, so I encourage you to reach out to your own personal providers to find out what options are available for you. In terms of bed capacity, the capacity across Los Angeles counties changes minute by minute. The information that we have is from private hospitals and is daily self-reported to the EMS agency. Individual hospitals may have more frequently updated data throughout the day, and I would direct you, if you have specific questions about individual hospitals, to contact them directly for the most detailed information. As reported previously, there is a total of about 23,000 beds and 2,200 ICU beds across all hospitals currently in the county. With our private hospital community right now, there are still about 150 open ICU beds, with still 96% of hospitals reporting. Within the DHS hospital of 4 acute care facilities, we have just around 1,500 beds with a current occupancy of 70%. That applies to both the medical surgical units and the intensive care units. The Emergency Medical Services Agency continues to monitor bed and equipment capacity across all hospitals real time and is helping them to procure the resources that they need to take care of patients. EMS is working to fill hospital requests for personal protective equipment, including masks and gloves. These are from stockpiled reserves from the state and federal government. EMS has established a coordinated distribution network to move supplies from the county's warehouse to health facilities. This is being done in partnership with the LA County Office of Emergency Management. Hospitals are also preparing for an additional need for ventilators in the near future, as well as blood products, which I've mentioned before. EMS and the county's Emergency Operations Center will continue to work with the state, local, and federal agencies to ensure that hospitals receive the supplies they need from these emergency stockpiles. In closing, I want to say that hospitals across the county will continue to be strained in the days and weeks to come. However, the overall healthcare system continues to be strong, but will only remain so if we take the urgent steps that are outlined by the Public Health Department to prevent the spread of COVID-19. Thank you so much. Sorry, next is Dr. Deborah Dorado, Superintendent of LA County Office of Education.
Good afternoon. I also want to reiterate that the health and safety of our children is our #1 priority, and districts across the county serving 1.5 million students are meeting on a regular basis and getting together to ensure instruction continues and that meals are being provided to our students. Yesterday, the governor issued an executive order providing flexibility on restrictions that will remove some of the barriers from our ability to respond to the current situation. Yesterday, we received K-12 guidance documents from the California Department of Education for the governor's executive order on 3 areas for schools. One is on distance learning, making sure that instruction continues, whether that's through standard-based instructional packets, online ability for instruction, or using television. We also received information on ensuring that our most vulnerable students continue to receive meals, and districts are providing meals at multiple locations and multiple times to ensure that their children are fed. We are also working hard to support families with their child care needs when possible. There was a webinar just this morning with State Superintendent Thurman, which gave districts the opportunity to ask questions and get clarifications on some of these guidelines. Yesterday, the governor stated we are looking at a possible extension of school closures. Although none of us know how long this will go on, we are doing everything possible, reassessing as we go to ensure that instruction continues and that children are fed. We are working very close with all 80 of our school districts, thinking about this maybe longer than we had anticipated. Again, we are focusing on distance learning and providing support to our districts, to our teachers, to our parents and students to enhance distance learning. We are providing professional development for teachers and other employees to help support remote learning. We're also ensuring that we have the devices and the connectivity for children and families. As was mentioned, we have challenges with the resources, and we are looking for assistance to ensure that every student who needs a device to continue with online instruction has it. We're working with philanthropy to help us during this difficult time and to ensure that we are able to secure the resources and the funding that we need to get through this difficult time. At LACO, we're hosting daily calls with all of our 80 superintendents. Every morning at 7:30, we are having conversations, talking about what's going well, what are some of the challenges, what are some of the resources that they need so we can support them as they are working around the clock. We have teachers who are working extremely hard to get trained so that they can provide the online instruction and remote learning that is required at this time. I assure you that everyone is working very hard to make sure that we're doing the best that we can in this situation to continue instruction, to make sure that our children are fed, to support our families. And I have no doubt that if we follow the directives from our Department of Public Health and we all stick together in this, we will get through. Thank you.
Excellent, and we are ready, Paul, for the Q&A portion in English. Following the Q&A in English, we will be switching over to the Spanish language.
Thank you. Ladies and gentlemen, if you wish to ask a question over the phones, please press 1, then 0 on your telephone keypad. Repeating the 1-0 command will withdraw your question from the queue. If using a speakerphone, please pick up the handset before pressing the numbers. So once again, for questions at this time, it is 1, then 0 on your telephone keypad. It'll be a moment. We have several people queuing up, and we just need to get their names. Our first question will come from the line of Claudia Pichuda. Please go ahead.
Hi, Barbara, this question is for you. Given all the measures that have been taken and all the talk about flattening the curve, I think a lot of people are wondering why not just issue a shelter-in-place order now to try to flatten that curve as much as possible? And also if we can get an update on the testing numbers. Thank you.
Oh, yeah, thanks so much, Claudia. And I think it's a great question. I do want to acknowledge that even in those communities that did a shelter in place, the very same groups of people that I mentioned are essential workers and need to go to work are going to work. We need to have food so that we can feed people. Our water services need to be operational. Our electric grid needs to continue to operate. We need all of our public safety and first responders and healthcare workers. And I think our guidance is very similar. We are asking that everyone who can stay home, stay home. Everyone who has flexibility with their workplace to work from home should be working from home. But we're also acknowledging that the essential workers that need to go to work need to be supported so that they can go to work. They have vital jobs that we need more than ever in this time where, in fact, we are facing massive disruptions that could, in fact, overwhelm some of our sectors. So, I appreciate that the language of, everyone is sheltering in place really feels like, well, then everyone will stay home. We've closed down just about everywhere that people can go to be social with other large groups of people, and we've asked everyone to stay home here across the county. Then that's uniform in Long Beach and in Pasadena and here in LA. We're constantly working with both the general public and specific sectors so that they can understand how to best do this. And I think that's the challenge for all of us, is figure out what does it mean when we tell you to stay home? What does it mean when we ask you to distance yourself from others? And how do we best protect those who we all owe a debt of gratitude to, who are doing those essential services that in fact make it possible for the rest of us to be able to stay at home. So thank you for the question. We'll get you the testing numbers shortly. It's taking us a little longer with all of the commercial labs, but we'll send that over as soon as we can.
All right, thank you.
And our next question will come from the line of Marielle Garza. Please go ahead.
Hi, this is a testing question for Dr. Farrar. There are some concerns that wellness people who aren't symptomatic are cutting the line to get tested before people who do have classic COVID-19 symptoms and can't get tested. And as we ramp up testing, what authority do you have to ensure that tests, especially those produced by the commercial labs, are only going to those who fit the established testing protocol that your office has released? Or is that completely up to healthcare providers to decide?
Yeah, thanks, and I apologize that there was some static with that call, but the question really was about testing and how are we making sure that folks aren't jumping the line to speak, getting tested when they don't really need to get tested. The new guidance is clear, so I can be clear about what the new guidance says, which is that you need to have a provider order the test. What it does give is a lot more latitude for you to work directly with your provider and no longer have to go through our county public health lab to get the test. When we were the only place that offered the test, you did have to talk with our staff in order to be able to access the lab. And you can imagine when we only have one lab in the county, we had a lot of guidance to try to prioritize, just like you noted, that those who are most seriously ill were tested as quickly as possible. Now, providers anywhere in the county can do an assessment with their patient and decide, based on clinical information, that their patient ought to be tested. And I repeat, the only way to get a test here in LA County through both the commercial labs, the hospital labs, and our lab is with, what I would say is like equivalent to a provider prescription. So thank you.
Thank you. Then next, we move to the line of Robert Garova. Please go ahead. Whoop, I'm sorry, Robert, you'll need to re-hit 1, then 0. We lost you from the queue. Until we get, okay, there we go. Robert, please go ahead.
Okay, thanks. Dr. Ferrer, I believe you said last week that testing was dependent on getting reagents from the CDC. Is that something you're concerned about now, and is it hampering testing?
Yeah, I want to thank everyone who contacted our federal partners. We have the reagents we need, and the feds have actually relaxed some of the rules on reagents, so we're able to use research study grade reagents now, which has really opened up a much bigger supply of the reagents we need at our lab and other people need at other public health labs. But thanks for asking. Yeah, we're in much better shape.
I had one follow-up, too, if I may.
Sure.
So you mentioned yesterday there was someone on your team dedicated to coordinating with the federal government. I'm wondering if they heard anything at all about the community-based testing centers that the federal government are rolling out this week.
Sure. I also want to, this is a great opportunity for me to thank our county fire department, who's also assigned their medical director, Dr. Kazan, who will now be helping us sort of really coordinate with all of the labs. So we have a lot of labs that opened, and that's all good news. And sorting through which requirements apply to which labs and which labs are using which type of testing is a huge task. We're still doing that. I did promise you by the end of the week we would have a lot more information. I do want to say that we opened yesterday 3 places where folks could go in the county system with again, these are people who are providers, are looking to test, to just practice what it looked like to offer that option to collect specimens while you stay in your car. And I want to say, we're really pleased to report that it's going to work and that we're going to increase our capacity, as is everyone else, to make it much easier for folks who need to get tested because they have a provider directive to get tested, to find a place in their communities where they're able to do that.
Thank you. Then next we'll go to the line of Dave Lopez. Please go ahead.
Yes, good afternoon, everyone. Doctor, we keep hearing that the real peak numbers are still 45 days away. Is that truth or fiction?
Nobody knows for sure, so I want to start by saying, I wish I did, because there's a lot of planning that we need to do to be well prepared to manage the increasing cases. All we can do right now is look to what's happening in places like Italy. I mean, we've seen what happened in China. Now we're paying a lot of attention to Italy, to Germany. And we're looking at what the curves look like. It is, I think it is really fair to say that this could be a 4 to 8 week time period where we're going to continue to see more cases. My hope would be as we get closer and closer to 4 weeks, although we'll still see an increase, the increase will indicate that we are in fact effectively flattening the curve because there won't be so many new cases every single day. But from now for the next few weeks, we will see a lot of new cases and a lot of new cases every day.
If I may, real quick follow-up, since you mentioned Italy and the curve, I just read somewhere this morning that they took some statistics. 99% of the fatalities are people who have other illnesses, and the average age of the death is just under 80. Is that a pattern we could see here in California?
Yes, I think it's a great question, Dave, and thanks for asking it. We've said from the very beginning that there are some populations that are much more risk for having serious illness should they be infected with COVID-19. And it certainly is people who are older. And for every year you age after 65, you have an increased risk for having more serious illness. So not surprising that all of the data, including the data from China, really supports this fact at this point that if you're older and or if you have underlying serious health conditions, you need to do everything we're asking you to do to stay home. And that's why I opened earlier by saying, please, let's not make it so hard for people who are older to get the things that they need, that they have to go out to the store. We really need to, all of us, offer our help and assistance so that people who are elderly have everything they need to stay home and stay home safely. But thanks for your questions.
Doctor, thank you.
Thank you. And next we'll move to the line of David Rosenthal. Please go ahead.
Hi, thank you. I was wondering, can you provide a number of confirmed cases that are currently hospitalized and perhaps the number that have recovered so far? And also, how many people are you expecting that will need hospitalization? The number of available ICU beds seems extremely low. I wonder how concerning that is and how many you are actually preparing for.
Yeah, I'll ask Dr. Galley to talk a little bit about the ability for us to have enough ICU beds. What I can tell you, and unfortunately I can't give you all the answers on the number of people that are hospitalized, but we will get back to you, and hopefully when we post the information, we'll have an accurate count of the number of people that are hospitalized. But I do want to say it looks right now here in LA County that somewhere between 20 and 25% of the folks that have been diagnosed with COVID-19 have been hospitalized at some point. Some have been hospitalized for 1 or 2 days, and some have been hospitalized for a slightly longer period. So we're tracking for the positive cases, just like you asked, those who are hospitalized. I just don't have the updated numbers based on the new count today, but we'll get you that information by the end of the day. And I'll ask Dr. Galley to come and sort of talk more about the capacity at the hospitals.
Hi, this is Christina Galley from the Department of Health Services. So as I mentioned before, there are 2,200 ICU beds. This is the same count as was provided yesterday. I don't have today's count on the updated ICU beds. Happy to provide that at a later point in time once that becomes available. Within the DHS system, that includes also 61 available ICU beds among our 184 licensed ICU beds. As I also mentioned, the hospitals all do have the ability to flex additional beds across their hospitals to make more space for ICU patients as needed. This includes using space in operating rooms, post-op PACU areas, emergency departments to be able to care for patients that need an ICU level of care, but outside of the licensed ICU bed capacity. So this will help increase the overall capacity for ICU beds if that is needed at a later point in time.
Thank you. Then our next question.
We have time for one more question, so unfortunately this will be our last question.
All right. Annabelle Munoz, your line is open.
Hi, good afternoon. This question may apply to several of you, and Dr. Ferrer, I know you addressed it a little bit when you spoke. When it comes to schools and restaurants that have ignored either orders or guidance from the county or state, what kind of enforcement are we going to see, if any, for schools that remain open, whether it be K through 12 or trade schools, and restaurants that continue to allow dining in? And then the following question is on testing. We've heard from a lot of people who say it's near to impossible or very difficult at this point, and many have raised questions about equity in this process, with celebrities or athletes getting or appearing to get faster access to testing. So how do you address those frustrations?
Yeah, so let me start with the first question, and I'm really glad you asked this, because I want to clarify that schools have not been ordered to close in LA County or in the state of California. Many school districts have made that decision out of an abundance of caution, but not because there was a directive. So schools that can adhere to the guidance around creating a safe space for students are in fact staying open as an essential service. So I hope that clears up the issue around schools. They can stay open if they can provide a safe place for both the people who work there and the students that are coming there. And we put a lot of guidance on our website for what that means, you know, what kind of social distancing is recommended for the schools. The restaurants, that's not true. The restaurants are in fact under a health officer order, and they cannot do any dining. They cannot offer dining services at any of the facilities. They can just offer takeout, pickup, or drive-through, and that is enforceable. We have health inspectors that are out. I want to say that there has been, to date, there have been restaurants who have stayed open, but when we have talked with them and explained what exactly a health officer order means, they have come into compliance. But we are out there and we are taking complaints and then calling those restaurants so that we can, in fact, provide some education and technical assistance to the restaurants so they understand what the order is.
A quick follow-up to that. In terms of the order that the governor made to schools, it was more guidance. We understand it's not being enforced. So is there confusion around whether or not there is this implied suggestion that schools should close?
You know, I think it's best to always, I'm not going to speak for the governor or his wonderful staff that have been working so closely with us. You know, I think guidance is really important. That's, you know, what I like to say is that, you know, guidance is very helpful, and it's very helpful if you're trying to figure out how to create a safe environment at your home or at your school. And I do know that the governor has the same intent that all of us do, which is to really encourage people to do as much social distancing as possible, wherever possible and whenever possible. And in some places, that may look a little bit different than it does in other places, but I think the intent has been the same. And I don't know if one of the supervisors would like to also just comment on sort of our ability to work together across the whole state.
Well, we are closely collaborating, and it is important to get the message out and have it be consistent. And we have worked closely with the state, as well as the city of Los Angeles and all of our other 87 cities, Long Beach, Pasadena, who have their own health department, so that the messaging remains the same and is consistent as to avoid confusion. But obviously the state is coming out with their recommendations, and then we take those, and through Dr. Ferrer, we coordinate to make sure that we are interpreting and getting that message out, which is why our website, lacounty.gov /COVID-19 is constantly updated so that we can refine when we get feedback as it relates to any confusion, because there is confusion in some areas, but we are getting clarification, seeking clarification, and working across the board.
Thank you. And whoever wants to take the question on access to testing.
Do we have anyone who wanted to address access to testing? Okay, we will have Barbara address that, and then that will be the conclusion of our English version. We will then switch to Spanish after that. So here's Barbara again.
You know, I feel somewhat ashamed that, you know, we continue to hear everywhere in the country about the frustration that people have about not feeling like they can get tested. And I particularly feel badly for those people who have been working with their providers, and their providers would like them to get tested, and so it's clinically appropriate for them to get tested, and they've still been struggling. I am really hopeful that with Dr. Kazan coming on board here in the county, we'll be able by the end of this week to give a lot better guidance, both to providers and to just our residents, about what this testing system really looks like here in LA County. You know, the confusion has been that when we started doing the testing, it was all at publicly owned and run labs. It's a really good thing that we now have expanded that to the commercial labs, but it requires a very different level of coordination. So I think we're really lucky. I want to commend Chief Osby for allowing Dr. Kazan to join the county team and really focus intentionally on figuring out how to best answer questions around testing, but most importantly, how to make sure the system is working for those providers and their patients who need access to testing.
Okay, now Paul, we will go into the Spanish version of the presentations. So the Q&A portion is finished now. Sergio, if you would like to come up to provide Supervisor Catherine Barger remarks.
Good afternoon. I am Supervisor Catherine Barger, Presidente del Condado de Supervisores de Los Ángeles. Gracias el día de hoy por unirse a nosotros. Nosotros estamos aquí para proveer información sobre los acontecimientos y actualizando los eventos de coronavirus, de este brote. La situación continúa cambiando día a día, tal como los líderes gubernamentales y comunitarios también continuamente están respondiendo para proteger y darle prioridad de salud a estas personas que lo necesitan. Después de haber escuchado nosotros al Departamento de Salud, los servicios de salud y la Oficina del Condado de Planeación de Emergencia, nosotros invitamos también a la doctora Debra Duardo para que hable. La doctora Duardo es la superintendente del condado, de las escuelas de Los Ángeles, y también ella se dirigió a ustedes con las últimas guías con respecto a los cierres de las escuelas, que se anticipó que sería hasta el final de este año escolar. Además, estas guías fueron dadas por el Estado esta mañana con respecto a los cierres de las escuelas de California, y también se han dado sugerencias que cada uno de los distritos locales de las escuelas continúe sirviendo a su comunidad con recursos para los padres y también los niños. El Estado también ha pedido a todos los distritos de las escuelas para que desarrolle un plan para asegurarse que los estudiantes sean supervisados durante las horas de escuela. Ellos también han dado información a todos los distritos del cierre continuo y de proveer los servicios esenciales para los niños y para las familias. Los líderes de California están pidiendo a las escuelas que consideren formas adicionales de que ellos puedan apoyar a los padres y a estos niños. Primero, el uso de sitios que la escuela le ha dado a los niños, son programas críticos para el cuidado de niños y también para las familias que también trabajan. Segundo, también nos hemos unido esfuerzos con agencias locales para conectar familias en necesidad de cuidado. Y finalmente, también proveer a las familias con una lista de programas locales que permanecen abiertos y que proveen estos servicios. Mucho más, también el cierre, también las prohibiciones de los lugares públicos de comer, por ejemplo, centros de entretenimiento, gimnasios, y que las escuelas se extienda el cierre de las tales. También esto va a tener un impacto inmenso a través de las familias en el condado de Los Ángeles, especialmente en miles de niños y jóvenes. Y seguramente también nosotros sabemos de que va a poner mucha presión a los padres, un número ilimitado de padres también de crianza y miembros de familia que también actualmente están viendo la forma de trabajar mientras que se están tratando de asegurar el cuidado de sus niños y que tengan acceso en línea a esos recursos de aprendizaje continuo. También sabemos que este impacto es emocionalmente y socialmente ha sido es mucho para estos jóvenes, quienes han perdido la interacción con sus amigos, programas deportivos, clases de artes y otras actividades que actualmente ayudan al desarrollo de la juventud y también de la madurez. Hay también miles de maestros increíblemente quienes que han sido actualmente dedicados a su trabajo, muchos de los cuales se les ha pedido que creativamente adapten sus métodos de enseñanza a las necesidades de los estudiantes de una forma remota. Yo también pido a los trabajadores, a los maestros que trabajan arduamente en los lugares de escuela cada día, especialmente ahora, con esto, de una forma independiente para navegar esta crisis y para poner el bienestar de los estudiantes primero. El Estado está proveyendo una información en línea para los padres que puedan tener acceso a varios programas, tales como el cuidado de niños. Además, el Condado de Los Ángeles ha puesto varios enlaces de información y sitios dedicados al coronavirus. Se puede encontrar el website en lacounty.gov/COVID-19. Doctora Debra Eduardo también compartirá más detalles acerca del impacto de los cierres de las escuelas y lo que el condado está haciendo para preparar a los jóvenes, a los que cuidan a los niños y a las personas, a los educadores. Gracias por su continuo apoyo a medida que navegamos a través de esta crisis, lo cual está afectando a todos nosotros. Yo continuaré implorando a cada uno de las personas en el condado de Los Ángeles para que usen el sentido común y las buenas intenciones de proteger la seguridad y el bienestar de nuestros jóvenes, adultos y personas de tercera edad. Gracias.
Buenas tardes, mi nombre es Hilda Solís, soy supervisora del Distrito número 1. Simplemente quiero decir que durante esta crisis también estamos haciendo más para ayudar a las personas sin hogar. Más de 5,000 personas son sin hogar y muchos de ellos son de mayor edad, 72 años. Y muchas personas sin hogar tienen problemas de salud que les ponen en mayor riesgo de infección. Por eso estamos viendo qué edificios y propiedades podemos usar para ayudar a las personas sin hogar. Para proteger su salud también vamos a poner más baños y estaciones para lavarse los manos en todo el condado. El condado continuará trabajando con nuestras ciudades para encontrar soluciones para esta emergencia. También quiero tocar el tema de alimentos. Quiero asegurarles que si hay suficiente comida y queremos que todos tengan acceso a los alimentos. Los distritos escolares de todo el condado están trabajando para dar comidas gratis a los estudiantes. Contactan a su distrito escolar o vayan a mi página web para más información. También es fácil aplicar para CalFresh. CalFresh les puede ayudar para pagar por sus alimentos, frutas, verduras, otras opciones saludables para usted y sus familias. También pueden llamar al condado o vayan a la página dpss.lacounty.gov. También quiero decir francamente que las personas que no tienen sus papeles, los indocumentados, pueden tener pruebas también del virus. Esto no va a afectar a su estatus migratorio. Para más información, por favor, contáctense en el número 211 o hablan con la oficina Asuntos Inmigrantes. También pueden ir a la página myhealthla.com. Muchas gracias.
Buenas tardes a todos. Yo me llamo Bárbara Ferrer, soy la directora del Departamento de Salud del Condado de Los Ángeles. Quiero empezar a dar las gracias a nuestros líderes locales que están tomando medidas rápidas para proteger la salud de los más de 10 millones de residentes del Condado de Los Ángeles. Especialmente quiero dar las gracias a las supervisoras Barger y la supervisora Solís. Hoy estamos reportando 46 nuevos casos. El número total de casos en el condado de Los Ángeles ahora es 190 y tenemos 96 casos nuevos en 48 horas. Todos los casos confirmados están siendo aislados y los contactos cercanos están en cuarentena. Según una nueva investigación, las acciones que estamos tomando en el condado son las más eficientes para amortiguar el virus, pero llevará tiempo. Veremos un aumento de los casos positivos hoy y mañana y en el futuro previsible. Probablemente vemos el aumento de casos de 4 a 12 semanas, pero esto no significa que nuestras acciones para combatir el virus no están funcionando. No podemos detener la propagación de COVID-19. En este punto, solo podemos frenar la propagación. Cuanto más lenta sea la propagación del virus, más podremos mantener la capacidad de nuestro viviente sistema de salud. Y esto es lo más importante. Es fundamental que tomemos en serio este virus y que practiquemos el distanciamiento social y cumplamos con todas las órdenes y pautas que estamos dando. El distancia social es crucial, pero no detiene la propagación del virus por completo, sino que hace la frena. Quiero tomar un momento para explicar más sobre el distanciamiento social. Todos deben quedarse en las casas tanto como sea posible. Siéntase libre de caminar o correr, pero no con un grupo de personas. Lo tienes que hacer solo con la familia. Recomendamos que siempre que sea posible los niños sean atendidos en sus hogares. Si está presentando un servicio esencial y necesita que ir a trabajar, gracias por sus servicios. Y por favor, visite el sitio web del condado si necesitas ayuda para descubrir cómo manejar el nuevo complejidad del distanciamiento social. Algunos trabajadores esenciales necesitan cuidado infantil, y ya que el cuidado infantil es un servicio esencial. Si su hijo está enfermo, el hijo se debe quedarse en la casa, y si usted está enferma, quédase en la casa también. Es especialmente importante que las personas mayores o con problemas de salud graves se quedan en la casa todo el tiempo. Y si bien apreciamos que las tiendas de comestibles ofrezcan horarios especiales para las personas mayores, la opción más segura para todas las personas mayores es recibir alimentos y medicinas en sus hogares. El condado está trabajando para apoyar este esfuerzo. Nosotros todos que tenemos que comunicarse por el teléfono con nuestros familiares y amigos y vecinos mayores. Y tenemos que ofrecerlos, traerles todos sus alimentos y medicinas o cualquier otra cosa que necesitan para poder quedarse en la casa. Muchas gracias.
Muchas gracias por su atención. Esto concluye nuestra sesión informativa. Gracias.